guys are not careful, they will own hospital, hospice, home health, doctor's office, medication, insurances, and they're also going to own the medications.
AOC is going to make this greedy healthcare CEO, David Joyner of CVS Health, absolutely squirm while exposing the con job that he and his fellow healthcare CEOs have pulled on all of us. Just watch.
Mr. Joyner, you are the CEO of CVS Health, correct? CVS Health owns Aetna, the health insurance company, correct?
Correct.
And CVS, which owns Aetna, also owns Oak Street Health medical clinics, correct?
And I'm going to stop it here only because people don't know Oak Street Health Medical Clinic, for the most part, only services seniors. So Medicare patients, that's super important. She should have said this here, but we just want to make sure that you all really understand what it is that they're doing.
Yes, it does.
CVS Health also owns CVS Caremark, the pharmacy benefit manager, which helps negotiate some of these rebates and prescription prices, correct?
That's correct.
CVS Caremark helps determine the prices that patients pay for a third of all prescriptions in the U.S. In fact, I was following one of CVS's investor calls where
Before she goes into that, I just want to make sure that I'm saying this. This is where it gets a little confusing for me on to exactly what it is she's trying to convey, because the money in healthcare is in the insurance companies, right? I'm just going to be honest with you. Whoever doesn't want to tell you, I'm going to tell you. Aetna, Humana, Blue Cross Blue Shield, that's where the money is. So ideally, they would want to pay for prescriptions at the cheapest value possible, right? So if they're going in to negotiate these price points and they're having people pay into Aetna, ideally, just giving you the business side of it, they want Aetna to pay the least amount of money possible for these prescriptions, even if it's going to any of their, I think, 9,000 CVS locations, because CVS, brick and mortar location, we get all that. It will never be an insurance company in terms of profit margin.
Where they really laid out quite clearly what this means if you are a patient. This is what's known as a captive strategy. And CVS...
Captive strategy. Also, we talked about this before. We talk about people having palliative care and hospice companies, and you're like, or home health and hospice companies. And I'll keep saying there should be no company that has a home health and a hospice. There should be no company that has a nursing home and a hospice, because they're using that as a guinea pig to kind of get you in the, I use the word pipeline versus captive strategy. They bring you in one way that's easy to get you hooked and brought you in, and they maneuver you the other way.
And CVS, in the investor call, used the example themselves of a patient known as Kate. Kate has an Aetna health insurance plan right here, and which is owned by CVS Health. She then goes to a CVS pharmacy. She's connected to an Oak Street Health medical clinic. She sees a doctor at Oak Street Health who prescribes her medication. And then she goes to fill that prescription at a CVS pharmacy. So the price Kate pays for that medication is dictated by Aetna, CVS Caremark, and they also own the drug manufacturer Cordavis.
Yeah, but again, this is where, and if she wants to talk, I'd love to talk to her, because what we're talking about here, and this is where it gets confusing for me. I understand what she's saying, but ideally, even if they have Aetna, they still want to pay the least amount of money possible for the drug manufacturer, for the drugs that they purchase, nonetheless, right? So figuring out specifically how that works together, I'm not sure. So I'm going to try to follow here before I give you mine.
Mr. Joyner, this is quite a bit of market concentration. Wouldn't you agree?
No, I wouldn't agree that it's market concentration.
Okay, cool. Seriously, guy, it's obviously too much market concentration.
It's market concentration. I would suggest it's a model that works really well for the consumer.
Yeah, I think it works very well for CVS.
Could work for the consumer, hardly ever will work for the consumer, because you control too much of where the consumer can go.
Very well for CVS. I think, in fact, you all said on the call that you all call it a fully engaged member. It's great marketing there. Fully engaged member unlocks sizable value for payers and CVS Health. So the health insurance gets a cut, the pharmacy benefit manager gets a cut, the drug manufacturer gets a cut, and the patient gets screwed. I think the Federal Trade Commission has also found that healthcare conglomerates like CVS Health charge more for medications filled at their pharmacies. We're talking about 1,000% markups on medications for cancer and HIV. And, I think this is...
Some of that is true, some of that is not true. So it's not that simple. And I know if you guys haven't seen Mark Cuban, he has I think it's the Cost Plus pharmacies. That's what all pharmacies should be. I'm just going to be completely honest with you. But it's going to take people like Mark Cuban coming into the space and providing that service across the country. From what I see now, they're still in California. Now, specifically to CVS, have you personally, think about this, have you personally been to a CVS, purchased medication, and it's been more than where you purchased it somewhere else? I have not done that. I have not seen that, because again, when we purchase medications, we pay for the full price of that medication. And I have not seen that. I'm not saying that they haven't done this, but I personally have not seen this.
And, I think this is actually an interesting point of common ground that I may have with some of our Republican colleagues here in this hearing. Because whether you're a blue-blooded capitalist or a card-carrying democratic socialist, I think corporate monopolies are a problem. And this vertical integration...
I agree. And I agree. I believe corporate monopolies are a problem. But I think the worst problem in healthcare, again, if done correctly, it could be phenomenal. I just have never seen it done correctly.
Vertical integration is destroying people's ability to access care. I don't think we're seeing this across the board. And if they can self-deal, I saw something that was interesting from the opening statement of Mr. Hemsley from United Health, talking about how much United spends, 85% on care, Mr. Hemsley?
Approaching 90%.
Approaching 90%, but the ACA forces you all to spend a decent amount of that on subsidies on care. But when you own the care, when the insurer owns the pharmacy, owns the PBM, owns the drug manufacturer.
Again, and I'm not disagreeing with her. I actually 100% agree with her. But if Oak Street Health was a fantastic clinic for seniors, it's not a huge concern for me, right? I've been to Oak Street Health. I'm going to give you guys a small story. When we were opening up in Chicago, Oak Street Health had a couple locations. I've watched them grow in Chicago while I was opening up in Chicago and how they expanded quickly. One thing I will say that they did that I fully support was they had a office space adult daycare. So they had these green vans that would drive across Chicago, pick seniors up and bring them there. So as much as we might say, this is crazy, if done correctly, it can actually benefit the consumer substantially. But again, I've never seen it done correctly. But specifically to Oak Street Health, I actually like what they do. I like their model, and I like the fact that they've been able to be in business for so long. Also take into account, Walmart tried it, couldn't figure it out. Amazon is still trying it, can't figure it out. The senior business, the business of seniors, is very complex. It's very complex. It's one of the few things where you're actually trying to market to people and you have to physically still go find the people. They're not sitting on their phones on social media all day like someone who's 37 years old. It's a very difficult business model. And in my opinion, outside of GenCare, right, they're the only ones who've actually been able to figure this out long term. And when I saw them pick up people in Chicago in the snow, in these green vans, and take them to adult daycares, I'm gonna be honest, I was sold. That was pre the sale to CVS. But at that time, again, I didn't have a huge problem with it. Not only that, I liked what they were doing.
Owns the drug manufacturer. You also own the healthcare cost. You own a big chunk of the healthcare cost. And so, 100 years ago, we had this type of market concentration in our banks. And we did something about it when it crashed.
And I know you guys remember that because they decided and dictated who got what loans, where they got those loans, the percentage of rates on those loans, right? What she's saying is 100% correct. Like, you have to figure this out. The other part of this is there's no oversight. So we just let these people roll these businesses out and there's no one truly overseeing what they do. Or you say, well, you can't have a monopoly, but then we look up and you guys don't realize that you have a monopoly, right? And so then you're trying to figure out how do you navigate this space. And I always say this, it always seems to be the kids and the seniors. It's almost like easy pickings for you all. And that's what bothers me the most, right? It just feels like you guys are constantly bearing down on seniors and kids. And I gotta figure out, why is that? Like, Why is that the one that you go to the most? I know why, but I'm not going to tell you guys why.
When it crashed the economy. And we passed the Glass-Steagall Act. We should be considering that in our healthcare system.
Agree 100%. I think that that's where we are right now. But just to dig into what we're talking about, CVS Health, for those who don't know, they have 9,000 locations. This is probably one of the biggest retail / pharmacy brick and mortars we have. Not if it's one of the biggest we have in specifically America. You pretty much see one on every major street. All types of pharmacy, whatever you are being sent, you can go pick it up from there. Chronic illness, chronic medications, specialty medications, they do that. They also do delivery medications, which for a lot of our seniors, I actually love that part. Then it gets interesting. The Minute clinics and the Oak Street Health clinics, particularly for Medicare patients, what does that look like? And is that ecosystem, does it work? And we were talking earlier today, and a point that was brought up is if you go to Oak Street Health, you need a medication, they write you an order from that medication. Do they just automatically send that to CVS? That's the question she should have asked, right? That is the real question, because I can tell you as a hospice owner, when I go to a hospital and I try to get a patient that's in the hospital will be sent to another hospice company, right? They don't tell them, hey, there are other options out there. That's where I have a problem with the healthcare system. That, in its very sense, is where it's like, it drives me freaking insane. And it's like, we're here to help people. Even if this company is not the best or not most convenient for you, you shouldn't have to go there. So if you're saying, well, you don't have to go there, right? That's what the CEO would tell me. That might be true. But if you don't tell them there's another option, or, hey, we can send this to a Walgreens that's 2 minutes down the street, you still aren't really giving them choices. And if you take away our healthcare choices long term, I'm not comfortable with that, because I'm seeing firsthand, and I can have no problem telling the senator this as well. What I'm seeing firsthand is that healthcare choices are being stripped from our seniors. This is the worst thing I've ever seen, particularly in Atlanta. It is literally gotten insane. And so we need to do a better job, and you all are fighting CVS, but on the ground level, we need you to come help us fight here too. Now, I know you're in New York, but we do need people that are here to help us fight here as well. The other thing, Caremark, which actually negotiates the price of these medications. Again, this is where it gets interesting to me, because if I'm Aetna, I don't want to pay a lot for these medications, but if I'm CVS, I want you to pay the most for these medications, or at least I want to buy them at the cheapest price and then sell them to you. The whole model doesn't make sense. I don't honestly see how you can own both and do business well, because the ideas literally conflict each other, right? So I don't see how that works. However, they've obviously figured it out. They also have a lot more money to play with, so it's interesting. But ideally, CVS can insure you with Aetna. And I'm going to stop right here and say this too. When you have an insurance company that controls your doctor, your pharmacy, which meds you get, and they're getting paid every step of the way, they also can dictate where you go to, like a hospice. They cannot give a hospice contract. They can just say, oh, we're not going to give you that contract. And then what would they do? The same thing that we saw Humana do. They go out and buy their own hospice company. They go out and buy their own home health companies. And then what do? I have a letter where I got a letter from an insurance company saying you're no longer in network right after they bought another hospice company. So the idea of patient choice, for me, we're getting too far offline here. We've got to get back to not only them knowing they have choices, but you giving them choices. And don't give them, and I did a video about this, don't give them choices owned by the same person. Don't tell them to go to a home health and you all own all 3 of the home health companies. That's not patient choice. That is just one umbrella company, and you're giving them this. Give them choices. Give them companies that they can work with that are different, that have different ownership groups. That's very important when we're talking about this. Now, I will say this, because CVS, Walgreens, they have cornered the market. There is a convenience factor here, right? So we have to be understanding of that they do provide convenience for our seniors, for people who want to go get medications, who may want to go to the clinic, because they have clinics inside of CVS now. If you guys haven't seen it, you can go inside CVS and go to a clinic, but they also have the Oak Street Health Clinic. So they're kind of doing some of these things that could help. Now, could this be impactful, large scale in healthcare? And what does this look like? 2 things I've been saying for a while. I think hospitals within the next 10 to 20 years are going to go out of business. I think that the funding, the funding has already been cut. And as that funding has been cut, and now you're going to cut out people's insurance or ways to get insurance, so they're able to pay for certain things, and the hospital still having to see people, hospitals are going to go out of business. It just hit me. If you guys aren't careful, this company will also own the hospitals. So imagine version. You're in Atlanta in Grady, which is going to use Grady because it's a big hospital downtown Atlanta. This particular hospital, they lost X amount of funding. This is not something I'm thinking. You can Google this yourself. They lost X amount of grant funding. And now the bulk of their patients that are coming in, a lot of them are going to be Medicaid patients who are going to lose their health care. And you're saying, well, we pull back that, so they're not going to lose it. Yes, they are. But even if they pull back some of the healthcare things that they said they were going to pull back in terms of people still having Medicaid, they still made it so difficult to keep up with the checkpoints that people are just going to lose it anyway. It's insanely complex for an 80-year-old to keep up with their checking of their Medicaid. It's not fair to them. If they were to get their hands on a hospital, and this is where AOC, and hopefully she's okay with me calling her that, you guys have to talk to people who own these businesses who are not at that level. The reason is we can give you what's really happening. If you guys are not careful, they will own hospital, hospice, home health, doctor's office, medication, insurances, and they're also going to own the medications. You say, Harry, that'll never happen. Let me be very clear with you. The way medications work, and particularly with generic medications. You go to the CVS, they got what? Generic version of everything that you actually want. So now when you go to a hospital or a doctor's offices, they'll just tell you, go buy the generic version of what has been out for 7 or 9 years, because now they can also give you that one as well. That's just my tips. I would love to see what you guys think about it. Let me know in the comments. Thanks.